Hello, everyone. Welcome to the 2021 Dutchess County Retiree Health Insurance Forum. My name is George Salem. I'm the Director of Risk Management for Dutchess County. And today we're just going to go over an overview of your benefits, explain what goes on during open enrollment. First thing I wanted to point out is today is really an informational session. It's not a Medicare session. We will discuss Medicare, but there are a lot of retirees that are pre-Medicare, and we also have information for those retirees as well. So let's get started, and we'll discuss what's going on in the marketplace. Bear with me for 1 second. So risk management contact information. If you need to get a hold of one of us, you can either contact myself at the below phone number, the 486-2030, or you can email riskmanagement@dutchessny.gov. Either myself, the assistant risk manager, Jessica Berry, or you can email Michelle Thompson as well, the principal program assistant for the department. Any questions about your benefits or anything in general, just poke us an email, and we'll be sure to get back to you right away. What's I going to say? Questions. There is a Q&A feature on your screen. So from a computer, you're going to select a Q&A on the right side of the screen, and then just type in your question in the box and hit send. What we're going to do is at the very end for questions, we're going to kind of go through the questions that have been submitted. And obviously, if there's something from somebody that's of more of a personal nature, I probably won't address it now, but we'll try to respond to that person directly. But so if you have any questions, look for the Q&A on the right side of your screen, type in your question and submit it so that we can answer it at the end of the review. All right, let me work on the next slide here. So Medicare, a brief overview of Medicare. So for any of you who are approaching age 65, when you turn 65, you have to enroll in Medicare. About 6 months prior to your 65th birthday, CMS, or the Center for Medicare Services, will send you paperwork directly to you in the mail. Please don't ignore the paperwork. Please don't throw it out. You will need to sign up for Part B so that when you turn 65, Medicare becomes primary coverage, and whether you're with NYSHIP or you're with MVP, that will become secondary. You will need a copy of your Medicare Part B card when you sign up also. You have to send that in to risk management. So same thing, fill out the paperwork. They're going to send you the Part B card. Make sure you send that to us so we can get you all set up in the system. There's really 2 plans. NYSHIP has a Medicare supplement. So what will happen is when you turn 65 in their system, they automatically flip you to Medicare primary. And that's whether you have the coverage or not. But they will flip you to Medicare primary. We get the Part B card, which we give to NYSHIP. And then when you go to the doctors, you will hand them your Medicare card, Part B card, and you also hand them your NYSHIP card. If you are an MVP person, MVP has an Advantage plan, which is basically an all-in-one plan. Medicare pays them to handle everything, so you don't have to hand your Part B card in. You would give the Part B card to us, and then MVP will send you an Advantage card, and that's the only card you have to present to your provider. So you can either do the Advantage plan with MVP, or you can do the Medicare supplement with NYSHIP. It's up to you, whichever plan you feel makes the most sense for you. The 2021 standard Medicare rate is $148.50. cheapest way to get your Medicare Part B is to have it deducted automatically from your Social Security check. If you're not drawing down Social Security yet at 65, then they will bill you on a quarterly basis. But you definitely need to have Part B when you turn 65. You don't have an option. The carriers will all become secondary. And unfortunately, we've had some retirees that didn't sign up, and it created a gap in their coverage. And if you have a claim, they will not go back retroactively and cover your claim. So could be a lot of money out of your pocket if you make that mistake. Any questions, please email risk management or call us, and we'll be sure to go over, whatever you have and whatever questions you may have as far as signing up for Medicare. So our website, all information for retirees is located at the duchess.gov/retiree site. Really, risk management. There's a phone number on the site. This is a copy of the screen, basically a print screen of the screen that you'll go to, and there's a number on there for R&K. Now that is an announcement. So Rosenkiernan was purchased by a larger entity called NFP, which is a positive for both us and our employees and retirees. NFP is a nationwide broker. They have a lot more resources. They can bring a lot more resources to bear on our behalf. So the phone number is going to stay the same. That's the 518-244-4329 number. So any questions on your deduction that comes out of your checking account, you can call that number. If you are paying annually, which some of you do pay annually, that would be risk management that handles that. We send our bills sometime out in the month of January. Any questions on an annual bill, you would either email or call us here at Risk Management. But duchess.gov/retiree is the site you want to go to if you have any questions. Now, information that's available to you on the site, there is a summary of benefits. There are links to provider searches, and then there's forms to update your information. We're going to go through an example of the summary of benefits, but effectively get you an idea on how to read that and how to look at it. So if you want to look at your benefit plan, the link to providers, that's what all the carriers do now. A decade ago, they used to print up these phone book sized provider listings that we used to distribute to employees directly and retirees directly. And it's just with the internet and with everything updating so quickly, it just doesn't make sense to actually print those anymore. And if anything, those books would be out of date within a week of printing, because doctors are coming and doctors are going from all providers. MVP has doctors that come on that are new and have doctors that leave. So does NYSHIP. So your most accurate and the most up-to-date list is going to be the link to the carrier on the site, and that's really where you want to go. And we're going to give you an example of some of the forms to update your information that are on the site. And here are the links as I discussed. The different links, NYSHIP's general information. There's a link to PDF. That says 2020 at a glance on this PowerPoint, but on our website, it's already been updated to 2021. So for NYSHIP, you get a brief at a glance look at NYSHIP benefits, and then a summary of benefits and coverage. And then there are 3 or actually 4 different MVP links. Depending on which bargaining unit you're involved with, if you were CSEA or Management Confidential, that's the first link. That's the MVP plan design you would have for pre-65 retirees, because you'd stay on the active plan until you turn 65. The second link is for DCSEA retirees that are pre-65. The third link is for PBA retirees that are pre-65. The fourth link is the MVP Preferred Gold Summary, and that is the 65 and older Advantage Plan. So for those of you that are about to turn 65 at some point in the next year or so, that's the plan you'll be moving to. It really is designed for seniors, for retirees. Co-pays are better, and there's a variety of benefits that are not on the active plan. But on our website, these are linked. It's a PDF. You can print it out or save it at home, so you have a complete, explanation of what your benefits are. Also down below on the site, there's a NISHIP link for providers. There's the MVP link for the HMO providers, and there's the MVP Gold, which is the Advantage plan. And really, for the MVP Gold, it's any provider that accepts Medicare is going to be accepted by MVP Gold. So there are the links. They're on our site. Take advantage of it. If after this you forget how to get to the site, or you're confused on where the link is, or you're having a problem in general, you can email risk management or call us, and we'll direct you to the right place. But otherwise, there's just a wealth of information that's available on the county website. Summary of benefits and coverage. Back when the Obamacare plans came on board or came onto the marketplace, one of the recurring problems with healthcare providers were that each provider had their own format for the benefit summary or description. And it just made it very confusing for people to look at, an Aetna summary and an MVP summary and a NISHIP summary and try to figure out, what the benefits were between the three of them. So one of the good things about the Obamacare law was that they standardized what the summary and benefit of coverage paperwork looked like. So it's the exact same format, literally the exact same printing fonts and print size, but it just makes it very easy to look at what your benefits are and to compare between carriers. If you're thinking about going from NISHIP to MVP or MVP to NISHIP, it's very easy to look at those two summaries and go question by question and compare them. The following we're going to go through is just an example. This example that I'm going into right now is the MVP. It's the active and pre-65 plan for the MVP HMO, and it's in this exact same format. So you'll have on the far left column will be important questions. The middle column is answers, and then the far right column is why does this why does this matter? So to use an example, the third question here, are there other deductibles for specific services? So the answer is no, there's no other deductibles. The HMO actually only has copays. What is the out-of-pocket limit for this plan? So in network, copays all told up, your annual out-of-pocket maximum on an individual basis would be $7,150. On a family basis, it would be $14,300. So there is actually a limit to your copays, which you can hit. Skip down to something that's easier. So on the top, in the middle, specialist visit, $20 copay for this plan. It says in-network provider, it's $20 copay. There is no out-of-network coverage on the MVP plan. It is an HMO, although in the greater Hudson Valley into Vermont and a little bit of Massachusetts, there's a heavy network for MVP. So if you're looking for a plan in retirement that goes into other states or across the country, from a network standpoint, then you really should look at the NISHIP plan. But otherwise, if you're in the region, you're staying in the region, MVP plan is a very good plan. And actually, from a retiree standpoint, we're about evenly split between NISHIP and MVP. So it really depends on your personal preference. This SBC, the bottom here, diagnostic test. So if you look at it, within the network, lab office, no charge. Lab facility, no charge. Radiology office is a $20 per visit. So if you're having an X-ray or MRI, it's going to be $20. And then in the middle of the in-network, it talks about the same, basically $20 copay, no charge in the lab or the facility. And then again, it's not covered out of network. This is just an in-network plan. We skip down a little further, the drug card, which can be very confusing. This plan has really four three types of copays, including specialty, but it's a $5 generic, a $20 preferred brand name, and a $40 non-preferred brand name drug card. For those of you that are on long-term maintenance medications, meaning you're not just taking it for a month, you're going to take it for the rest of your life. It's definitely less expensive if you go into the mail order system, because they will give you effectively a 90-day supply for twice the copay, or a little over twice. On the top example, mail order is $12.50 for 90 days versus $5 for a regular prescription. So it's definitely less expensive. On the preferred brand name, mail order is $50 for 90 days versus $20 on a regular prescription. So you can definitely, if you aren't involved in the mail order, talk to your physician about it, or you can email risk management and we can help you get set up with that as well. The rest of the SBC, as you can tell, it's just a blow by blow on what the different charges are and what you have to pay. Emergency room, $50 copay. Emergency medical transportation, ambulance, no charge. Urgent care, $20 copay. If you have a hospital stay, facility fee, on this plan it says zero hospital. The other bargain, this is the CSEA plan. The other bargaining units may have a $250 or a $500 hospital copay if you go into the hospital. Outpatient services, this is a $20 copay. Inpatient services, no charge. And it just keeps going on and on. Obviously, this is an active plan, so it talks about pregnancy. This is not going to apply for most of the retirees. There's questions on coverage for your children, and that also doesn't apply. But what I would say is that the SBC is the best place. The summary benefit and coverage is the best place for you to get information on your plan. If you're going over that and you can't get the answer to your question, or you're confused, feel free to either call or email risk management. And also MVP, they have a toll-free hotline, and that's on the very bottom, page 7 of this plan. Someone will, on the 800 number, will answer your question if you have any questions on that. So that is an example of the summary and benefit of coverage. Retiree health coverage contact form. This is an internal form we try to get from every retiree, and mainly the reason for this form is so that we can have a current, up-to-date contact information for you. On occasion, it's very problematic. We have retirees that we lose track of, and then if there's some problem with your account, whether your bank account closes or something changes, or we need to get a hold of you, if we can't get a hold of you, it's a problem. And if your bank account that's paying your medical premiums ceases to function, we don't want to have a situation where you have a lapse in coverage. So if you haven't filled this form out already, you can get it off the county website, the website I just gave you, and please make sure you put in some sort of additional contact information. So if we can't get a hold of you, we can get a hold of either one of your friends or relatives that will let us know, where you are. Any questions on that? Again, feel free to email us at risk management, or send us an email or give us a call. So open enrollment for retirees. Unlike the actives, which every year you were required as an active employee to, proactively signify which plan you wanted to go into, we are not required to do that for retirees, which really means that you can just roll over. You don't have to do anything. If you're happy with the plan that you have, you can roll from 2021 into 2022 on the exact same plan. The only time that you need to let us know is if you decide you want to change plans. And that brings me to the update on the rates for the calendar year 2022. MVP has announced that roughly for the active plan, and the active plan is for retirees who are under age 65, the active plan is going to have a 3.4% increase roughly on your contribution. So that's what you can, if you're under age 65 and you're on the MVP active plan, you can assume a 3.4% increase. That premium increase will start in December, because if you remember, the premiums are due at the first of the month for coverage. So for January's premium is pulled in the middle, roughly the 15th of December. The January premium is pulled, and you'll receive a notice from NFP on that as far as the withdrawal. But 3.4% is the increase on that. For the plus 65 retirees that are on MVP, that is going to be a decrease for the Advantage plan. So if you're on the Advantage plan with MVP, they're looking at a projected 6.6% decrease, almost 7% decrease on your contribution from last year. So that's actually good news for everyone. Same thing, MVP, 6.6% decrease. NYSHIP, unfortunately, has not given us an indication on what the active or pre-65 rate will be for 2022, and they have not given us an indication on what the rate will be for the plus 65 Medicare supplements for NYSHIP. We have no idea. However, we would think from a political standpoint, perhaps the governor will not be in a big rush to jack the premiums up, but we have no idea. Typically, we find out in the month of December, unfortunately. So if NYSHIP does not give us enough time, we will not be able to adjust the withdrawal for your January premium. The withdrawal for your January premium is December 15th. And if we don't know at least 30 days prior to December 15th, what we'll have to do is your deduction will have to remain the same, and we'll have to make an adjustment in the month of January. But I am getting ahead of myself. It's only October right now. Hopefully, every year we pray that NYSHIP will let us know maybe in November when, what the increase is going to be for NYSHIP. But as of right this moment, we don't know. But as soon as we know, we'll let you know. Also, I don't know if we had mentioned to you, we did mention to you, the bank on your bank statements, for those of you who are having a monthly withdrawal pulled out, the ACH mark on that might have changed. It should indicate for your health premiums, but it might be a little different than what was previously coming out in terms of the label, not in terms of the dollar amount. And that is related also to NFP buying R&K. So anybody has any question on what's being withdrawn from their bank account and they're not sure, please give risk management a call, or you can call, you can call NFP as well, or R&K as well. All right, that was kind of a fast coverage of what the benefits are here for retirees and what the resources are for you. What I wanted to do is try to answer any questions people may have submitted. So we're going to go into the part of the the review where we answer some of these questions. And the first question out of the gate is, can I pay annually instead of monthly? Yes, you can. The monthly, we do automatic withdrawal from your checking or savings account. If you want to change to annually, you have to let risk management know. You can either email us or call us, and what will happen is we will make the adjustment, and then we will prepare an annual bill for you to send out in January. So if you want to change from monthly to annual, please contact risk management as soon as you can, so that we can put you on the list of people that want to be annually billed. The next question is, what Medicare plan is better? And that is a question that is very difficult to answer. It really depends on your personal preference. For those of you that were with MVP as an active, the vast majority of those employees stay with MVP. Their Advantage plan is actually a very nice plan. It has lower copays than the active MVP, and some lower copays than the night shift plan. But you know, the Medicare Advantage for MVP and the Medicare Supplement for night shift are different plans. And night shift again has that nationwide network. So if you're going to be retiring and moving to Arizona or Florida or somewhere else out of the area, you know, maybe the night shift plan would be the plan for you. But if you're going to be staying in the Mid-Hudson region, either plan would work fine. And also, you know, the contributions are close from one plan to the other, so it's not like one is extremely, you know, less expensive than the other one. So it's tough. It's a tough question to answer. Each plan, if you want, you can look at, I just showed you, go onto our website and look at the summary, you know, the SBC for the MVP Gold and the summary benefit coverage for the night shift plan. And you can go blow by blow what your copays are and what's available, and then you can make a decision on that, you know, for yourself. How do we sign up for Medicare? That was another question that we just talked about, but I'll answer again. Hold on for a minute. The paperwork from CMS will come to you roughly about 6 months prior. So you need to fill that paperwork out and send it back in, you know, or you can literally go over to the Social Security office over on Main Street if you need to do that. But you want to make sure that if you don't get your paperwork from CMS and your 65th birthday is coming up, you need to reach out to the Social Security office and find out what you need to do to sign up. But roughly, paperwork should come to you directly in the mail. Make sure you don't throw it out by accident. You know, it's definitely very important. Let me see here. I think we have some more questions. I don't know how to get to them. All right, so let's do that. What happens if I have MVP and I'm on vacation and break my leg? MVP does not have out-of-network coverage. However, it's an HMO, any you know, non-out-of-network plan has emergency coverage anywhere you're located. We've had people on MVP in a foreign country where they broke their leg and were able to get coverage for their doctor bills. So if you are in Florida, if you are vacationing somewhere and you get hurt, go to the emergency room, definitely call the number on the 800 number on your MVP card, and let them know, and they will file your claim in and keep on top of what you need in terms of your providers and the hospital that you're in. But you always have coverage, even if it's emergency, you're going to have coverage no matter which carrier that you're with. The next question someone asked is, are COVID tests covered? Yes, they are. COVID tests are still covered by either carrier. So they are required to cover COVID tests. Now, a difference on there is going to be when you go to the carrier, a lot of times, well, actually not a lot of times, almost all the times, they want to require that you see a provider. You get your free COVID test, but they are going to have you pay a copay, a regular copay, to have the doctor walk in and shake your hand, say hello for 5 minutes. So unfortunately, there's no way to get around that unless you go to a testing center that is affiliated with a carrier. But most of the testing centers still want a physician to be involved. So the answer is the COVID test is covered, but the doctors, you have to pay a copay. What do we got? When I turn 65 and have to pay the 148 Part B premium for my Social Security check, does my night shift premium go down by the same amount? Yes. So what happens is your night shift premium is reduced by whatever the standard Medicare Part B deduction is. So when we calculate contributions, which, you know, the contribution amount is based on your years of service and based on your plan and based on what plan you're in. But if you are a Medicare, if you're a Medicare person, like for an example would be for night shift. If you're a Medicare person with night shift, the night shift premium that we are making our calculations on, we reduce it by the $148, and then we apply your contribution to that. So the answer to that is yes. We reduce your premium by whatever the current Medicare Part B premium is. So, does anyone have any other questions? None, huh? Most recent. Let me see. No questions. All right. Well, for those of you who participated, thank you very much for your questions, and thank you for tuning in. Again, if you have any additional questions or you think of something, after this, please either send an email to risk management or you can call in. And if we don't know the answer, we know where to get it, and we'll be sure to get right back to you. Otherwise, thanks for attending, and enjoy the rest of your day.